Hello, and welcome to today's Lunch and Learn presentation, Health and Wellness 101. I'm Steve Reinches, President and CEO of North Kansas City Hospital. Thank you for joining us. Before we start, I'd like to go over a few housekeeping details. We've muted all our attendees to help reduce feedback. If you have a question, please submit it through the Q&A feature at the bottom of your screen. Click the icon to submit your question. Our speaker will answer questions at the end of the presentation. We often pair health and wellness together because you really can't have one without the other. Health refers to your overall physical and mental well-being. Wellness refers to the steps you take to improve and maintain good health. Michael Crim, a family physician with Meritas Health Briarcliff, joins us today to talk about a few health and wellness basics that can help you live a long and active life. Please welcome Dr. Crim.
Great. Well, thank you very much. It's really good to be here. I'm pleased that you've chosen to join us, and I hope that what we have to offer today is insightful and provides some help to you as you kind of navigate your health and wellness in your life. So to begin, I'd like to start by just going over a few goals. If I can get my slide to start moving here. There we go. So the goals of this presentation today are to improve your quality of life, increase your life expectancy, maximize your wellness, and understand how to navigate the healthcare system. And to do that, to me personally, I feel like you have to have a little bit of historical perspective on where we've come from and where we are now. So if you go back to the year 1900, for those of, if there was someone that was born in the year 1900, their life expectancy was only 47 years of age. I came to this realization when I was about in my mid-30s, and I was really astonished at that fact. You know, I was kind of born and raised and thought that everybody pretty much just lived to a ripe old age of, you know, in their 70s, 80s, 90s. But it was shocking to me that people really, on average, in the year 1900, only made it to about the age of 47. And now we're easily living till 79. And there's some parts of the world where people are living into their 80s, including a life expectancy of 85 in Japan. So we've really come a long way. And to look at this a little bit further, I think it's important when we talk about health and wellness, it's important to know, you know, what we've overcome and now what are we looking at to try to avoid or do better with. So in 1900, some of the things that were affecting us the most were things like pneumonia, influenza, tuberculosis, and infectious gastroenteritis. Now with the advent of therapeutics, vaccines, antibiotics, we've been able to suppress or decrease the amount of morbidity and mortality related to those infectious things. And now we're left with heart disease and cancer being the two top things that we have to worry about if we want to try to maximize the quality and quantity of our lives. As you can look back at the year 1900, you know, cancer was down there about at number 8. And so now, and actually it's interesting that accidents or unintentional injuries are number 3 according to the CDC, but we're not going to be able to help you too much with that. You're just going to kind of have to navigate that one yourself. So treatment of infectious disease, reduction in communicable disease, improved sanitation, and expanded access to health care were all, I think, instrumental in actually increasing our life expectancy. And the reason I tell you this is because, one, it's not only astonishing, but I think it's something that we need to be grateful for, and also to realize how we got there. Because I do have a significant number of people coming into the office that say, you know, I offer them a therapeutic or way of treating something, or maybe I'm trying to get them to take a vaccine. And they say, well, you know what, I'm not really a medicine kind of person, they say, and they'll put the quotes up, not really a medicine kind of person. And I like them to understand this history because, you know, I'd like to say, well, you know, and it's also, they say, well, these medicines are not natural, for instance. I don't like to put unnatural things into my body. And I like to say, point out, well, it's also not completely completely natural to live beyond the age of 47 in some respects, if you look at it from that type of a historical perspective. So to me, it's better living through modern science. And, thank you to Alexander Fleming for finding penicillin in the 40s and getting the increase in the antibiotics. These were all really great things that help us live longer, healthier lives. So we're seeing different diseases now, things that we never even really knew that existed. I mean, people in 1950 didn't know about high cholesterol, I don't believe. They weren't as worried about high blood pressure. And now we're looking at these things, and our bodies aren't really, incredibly well designed to withstand the ravages of time with respect to osteoarthritis and osteoporosis. But thankfully, with modern medicine, we're able to do a lot of things with these things as well. But we run into issues with cognitive decline, sight and hearing. All these things are just things that come with living longer. And it's great to live longer, but we also have other problems. So from my standpoint, to maintain your quality of life and extend your life expectancy, it's important to have an awareness of the most common causes of disease and death as we age, develop a consistent, healthy lifestyle, engage in evidence-based medicine with your primary care provider, and have a little luck from genetics, probably. This is a picture of my great aunt Clara. She was 92 at the time, and we were at Royal Gorge, Colorado. And she's just a lovely human being. I'm just very happy to know her and to have had her in my life. Sadly, she's still living, but sadly she's dealing with some dementia and some cognitive decline now, and I believe she's close to 97. But the point of this slide is, so she's doing very well into her 90s, if we could all be so fortunate. But one day, I think, as we often do with people who are living older, we tend to ask them, what are you doing? What's your secret to longevity? I said, and I'm kind of half wanting to get, kind of a funny answer, something that she could make up and just say because it's funny. Or maybe I think maybe she's got some real secret she could tell me, that she could really tell me what's going on. And she kind of thought about it, and I think in a very serious way, she said, well, I think that the reason for me doing so well is that I actually go and I see my doctor twice a year. And I was a physician at that time, and I was really, wow, that's really completely unexpected. You see the doctor twice a year, and that's one of the main reasons why you think you live so long. Of course, I don't think that's all true. I think she had a great lifestyle, and I think she had some pretty good genes, but she also was seeing her doctor twice a year. Well, what's the significance of that, if you ask yourself? And really, to me, I think there's a lot more significance to that statement than meets the eye on the surface. Because one of those things is that there are a lot of people that come in. I see probably 2 or 3 people a week that say, well, doc, I don't come in unless I'm sick, or there's nothing really wrong with me. I've done really well for a long time. And the point of all of this is that, a lot of disease occurs when people do not have symptoms. It's asymptomatic disease. We all know that diabetes goes on for a long time in many people before it's actually diagnosed and recognized.
So Dr. Crim, I would like to take a little pause. On the screen that I'm looking at, there's a little yellow box, and we want to try to get that eliminated. Okay. So if we could take just a 10, 15-second pause.
Yeah.
We're going to try to get rid of that yellow box. And I love the presentation, and I'm sitting upright and listening because I want to be like your aunt.
Yeah, don't we all? If we could all be so lucky. I've seen that box too. I guess I didn't know if that was, I assumed that maybe it wasn't visible, but that would be kind of, looks like you got it.
Okay.
Okay. All right. I think we're back. So the point of this is that a lot of disease occurs without symptoms, and it's important to detect that disease early. And, insurance companies often pay for wellness exams. They encourage you to do it, but a lot of people only come to the doctor when they're feeling sick. And it's difficult for a physician to actually do wellness and sickness stuff all at the same time. It is done, it can be done, but you often are diluting things a little bit and making it difficult to get everything done within maybe a prescribed amount of time. So I would encourage you to consider having the wellness visit so that you can avail yourself to all of the possibilities that can come from that we're going to talk about a little bit. So let's try to get I'm trying to get the slide to go here. We can try it again. I'll try over here. There we go. Yeah. So when I went to my doctor about 10 years ago, I've been to the doctor since, but one of the doctors I saw asked me, what is my greatest asset? And I said to myself, is this a trick question? I'm not sure really what he's trying to ask me about. I don't think it's financial. I said, well, is it my family? And he said, no, it's you. You are your greatest asset. And I guess that's a matter of opinion, but I thought it was a pretty good statement. And there's only one of you. And I guess what I would say is that, you look around and I do see in the office that a lot of people put priorities, like maybe it's their new car or keeping up their car or the maintenance on their car or, it's something about their house. People will take the time, spend the time, the effort, and even the money to take care of something that is replaceable or fixable, but they often neglect themselves. And I think it's really important to keep that in mind and to come in to see the doctor even when you're feeling well, so we can determine whether there's something there that you're missing. So there's 3 types of general prevention that we think about. Primary prevention is to do things to keep disease from happening. So if you're exercising and maintaining normal weight so you don't get diabetes or overweight or obesity, that would be primary prevention. Secondary prevention occurs when you have a disease, but you don't know it. Maybe your cholesterol is high, maybe your blood pressure is high, maybe you have a developing cancer. And if you come in and you don't know it because you're not symptomatic of it, maybe you've got diabetes and you don't know it. So screening to detect disease that's already there at an early stage is secondary to prevention. And then tertiary prevention is really more about a problem-based visit, because what you're doing is you're treating a medical condition that exists and you're trying to slow it down from getting worse. So those are the kinds of prevention. So wellness visits are there to provide evidence-based medicine, promote optimal health and well-being, offer age-appropriate screenings and immunizations, and it involves both primary and secondary prevention. I just realized the clock on my computer is not there, so I might need some help keeping time. I'm also going to tell you that I have too many slides here. I realized that last night, so we're gonna jump around a little bit. So I want to talk a little bit about testing when you see the doctor. There may be some of you who know this doctor. It's Dr. Leonard McCoy. He's on the Starship Enterprise in the 23rd century, and he's got this special little thing in his hand that detects disease, and it was really amazing. He could pretty much tell you anything about your body by waving that over your body and looking at the screen. He could tell you what was going on. Well, unfortunately, we're not that sophisticated yet. A lot of people ask us, well, why don't we just go ahead and get a whole body CT scan? Why wouldn't we do that? And to some respects, that does make some sense. Why wouldn't you just do that if you could? Well, part of the problem is getting a CT scan of something like that of your whole body is like opening Pandora's box. I see this all the time where maybe I had a nice woman who's a very young 90-year-old woman who came in to see me as follow-up for a scan she had, and they found something on her kidney. And it was with a CT scan, it was found incidentally, and the radiologist said, well, you need to go and have an ultrasound now so we can kind of clarify what that is. So I sent her for the ultrasound. She went and got the ultrasound, came back, well, that's it's still indeterminate. She needs an MRI. So then I sent her for an MRI, and she went and had and then this is just medicine. I'm just, just leveling with you there. Because I know it sounds terrible, but this is kind of how it is. And so you have to understand, and you do these tests, there's some good and there's also some bad that can come of it. Well, she got the MRI. It's still inconclusive. So they said, well, let's repeat that in six months to make sure that everything is stable. So, when you're going to look for something, sometimes you don't find what you're looking for, and sometimes you find a whole lot of else. I've done an MRI of somebody's brain, and there was a giant cyst that had been there for 40 years, evidently not affecting him, but we had to send him on to go see somebody else because we didn't know for sure what it was or if it meant anything. anything. There is not a unified one laboratory test for cancer, unfortunately. There are some biomarkers that can be done in certain cancers, but there's not too many tests that look for all cancer. And we're going to get into that a little bit. So I think it's important as a healthcare consumer to be aware of where are your doctor recommendations coming from. The main one I would say is the U.S. Preventative Services Task Force. It's an independent volunteer panel of national experts that are epidemiologists, scientists, physicians that are very good at crunching the numbers and looking to see if a test is worth its weight. Interestingly, they do not consider cost as a factor. And they make these recommendations for, should I get a mammogram or should I have a colonoscopy? And they grade them as A, B, C, and D. Well, the A and B are things that they recommend because A is, it's highly likely to be substantially helpful. B is moderately helpful. C is indeterminate. D is probably not helpful, and I is indeterminate as well. There's some slight variations, but you should know when you see a doctor, like I'm a member of the American Academy of Family Physicians, so they have guidelines. The American Cancer Society has guidelines. So as we're going through, these are some of the preventative screenings that you'll be offered, and with some of them I put letter grades with them. So for colon cancer, wholeheartedly, there's a letter A by them. That absolutely, there's a definite benefit and decrease in disease and death if everyone is checking for colon cancer at the age of 50, starting at the age of 50. You know, mammograms, it's interesting. The United States Preventative Services Task Force, or USPSTF, where is that? Breast cancer. It says a letter B, so it's a good recommendation at the age of 50. But many of us know that we often recommend that women get their initial mammograms at age 40. So there's a lot of variation, and you can talk that over with your doctor. The American Cancer Society recommends, starting at the age of 40. So there are these variations that you see that occur. Prostate cancer is a big one. You see there's a recommendation of C. So it's something you probably ought to talk over, with your doctor a little bit. So these are basic things that you can do as secondary prevention to screen for conditions you might have while they're still treatable. And so, now with this pandemic that we're experiencing, there's the issue of testing for COVID, and most of us have become now familiar with the situation of false positive and false negative tests, and that can be pretty confusing. And so a way of determining which tests is more accurate than another one is as a statistical principle of sensitivity and specificity. And so, as we know, some COVID tests are better than others. And sometimes it depends on how well the person does the test. Did they get the Q-tip all the way to the back of your nose or almost to your brain? How was the test run? It affects its sensitivity and specificity. So let's take colon cancer screening, for instance. If you just check for blood in your stool, the sensitivity here says it's 74%. But what that really means is that 26% of the time it could miss colon cancer in somebody that has colon cancer. And if you're the person being tested, you don't really want that, right? So the specificity of it, though, if it is positive, then what that means is 5% of the people testing positive are falsely positive. So that's kind of how those, it's pretty confusing, but I just want you to understand kind of some of the vernacular and some of the terminology and the way that we're looking at these tests. One of the big things right now is, do you get a Cologuard, which doesn't involve as much effort for colon cancer screening, or do you get a colonoscopy? Well, the Cologuard is almost as sensitive at detecting cancer as a colonoscopy. But you can't remove polyps or precancerous polyps with Cologuard. I think that's one definite disadvantage. And then as far as specificity, they're about the same. So if you have if a positive, you see something in there, it looks like colon cancer, then 87% of the time it really is, and 13% of the time it could be a false positive. And these kinds of things happen. So all these things have to be really considered when you're thinking about testing. Okay. just a brief word on testing for your heart. There are big differences. There's a cardio scan up there at the top, very sensitive at detecting disease, but we're looking at disease that can actually cause a heart attack. And so a lot of people have a positive test and go get tested, but they don't turns out they don't have substantial disease 60% of the time. So we do that as a screening test, but it's also maybe not as we get down to heart catheterization, you can see that's approaching 100% because they're just looking at your coronaries that have been illuminated, with contrast. They can actually just see it. Why don't we do that on everyone? Well, I don't know how much it is, but I think it's more than $10,000, or it's a lot of money. So you can't do that on everyone. You have to kind of figure out what you're going to do, and none of these are perfect. Okay. So here's your adult immunizations that are recommended. Take a quick look. We're not going to be able to spend a lot of time on these. Influenza, a yearly one because the virus mutates every year. I liken the influenza vaccine to a seatbelt because everybody wants to say, well, it's not guaranteed. Who knows? But same thing with the seatbelt. We know statistically you're safer with one on. Makes sense to wear it. That's how I feel about influenza vaccine. And all of these vaccines are pretty important as far as preventing. It's primary prevention. So moving on to cardiovascular disease. So that's stroke and heart attack, and some things you can't get away from. You can't go away from your age, your family history, and gender, but modifiable risk factors you really can do something about. And I want to focus really on cholesterol and hypertension briefly. We'll talk about obesity in a minute if we can get there. So blood pressure is an ongoing tough issue to tackle in the physician office, because what happens is a patient comes in and I'm like, wow, your blood pressure is kind of high. No, it's not. Yeah, it is. No, it's not. Yes, it is. It's high, and that's an ongoing issue. It's like, well, it's high today. Why is it high today? Well, I just ran in. I just had a cup of coffee. I have white coat hypertension. And so the reality is physicians with one reading can never really truly know, is your blood pressure high or not? The American College of Cardiology and the American Heart Association got together and recently moved the goalpost back for you. They lowered the definition, so it's harder to have normal blood pressure. Look at these numbers. They want you to be less than 120 over 80 for the most part. You're considered elevated in 120s and high in the 130s now. So it's increasingly difficult to have normal blood pressure. So what are we going to do about this difficult thing? These are all the things, because blood pressure is very dynamic and it's changing, and it often changes due to all those things that you see on your left. I've recently discovered, and I was very happy to see this, that you can actually go to a place where you can find a validated blood pressure cuff. I've been telling people to go to the store, get their cuffs, because I think the best way to deal with this is for people to own their own cuff. And you can go to validatebloodpressure.org and find a proper fitting cuff. And the majority of these are actually Omron. You can get them at Amazon or Walmart. But take a look, get yourself a good cuff, put it over your mid-upper arm, check yourself twice a day. Do it for 7 days. Don't obsess about it. Don't take it all the time. But blood pressure is one of those things that often occurs and can be terrible. I've had people in my office with blood pressures of 200 over 110 that are they're there for something else. So you can't really know, and it would behoove you, if you can spend a little time on this, to check your blood pressure and then get with your doctor with some reliable readings. And then once you're stable, with or without medication, then spot check it every 2 weeks or every 4 weeks a couple times. That's just what you need to do. Notice all these things on the side, though, that you can maybe avoid some of these things. Get better sleep, treat your obstructive sleep apnea, watch out for medications, try not to be too angry, try not to be in pain, get your pain treated. All those things can affect you. High cholesterol, something you won't feel until you have a major life-threatening event. So get it checked with your doctor at a wellness visit. There is a score called an Atherosclerotic Vascular Disease score that doctors will do. You can find this online. If you know your lipid results, it usually involves your total cholesterol and your good cholesterol. But it will give you a score as to what your risk is over 10 years. There's several different calculators. But if it's over 10%, if your risk is greater than 10%, I would encourage you to consider taking a statin to lower your cholesterol. Same thing with aspirin. If your atherosclerotic vascular disease score is greater than 10% at 10 years, consider a baby aspirin, but it's something that you need to discuss with your physician about that. That's one thing you can do. So briefly, we're just kind of flying around here, so I hope I'm not going too fast, but another giant issue with wellness over long term, if you're gonna maintain your wellness, is maintaining a normal weight. And 73% of Americans are either overweight or obese. It's an epidemic of huge proportions. And I would say that you know, and I struggle with this myself. You can look at me and know that I enjoy my food. I do at that, but it's a difficult thing to deal with. And I think over the last 40, 50 years, our relationship with food has become very dysfunctional. You know, they're pouring sugar into it, they're pouring salt into it. You know, we don't really know what to do. We don't think about food in the right way. You know, when you think about what's for dinner tonight, you're thinking about what's the quickest, easiest, tastiest thing that I can get in my mouth in the next 15 minutes. You're not really thinking about health generally at most instances, and you're often not thinking whether you're hungry. So we need to change our relationship with eating. And so here are the numbers to consider whether or not you're overweight or obese. And again, most of us, you know, out of every four people is, or 3 out of every 4 are overweight or obese almost. So how do you figure that out? Write this down quickly, take a picture of it, but here's how you figure out your BMI. Right there, very easy. That's height in inches squared. Weight is in pounds. That's not metric here. And you can find out your BMI. So if actually, let me see if I brought this in. If I was a man, I was 250 pounds, and I did this, I could find out that my BMI was 34, rounding up, 34. So if you want to find out, well, what should my weight be if it was a normal weight, look at this equation. It's the same thing, just rearranged. You take 24, which is a normal BMI, just at the upper limits of normal, put your numbers in there, and you have what your ideal weight would be. Okay, so there's an easier way to go about some of this stuff. There are these calculators out there called MyFitnessPal and Lose It that you can put your stuff in there, and it's important that everybody has a calorie budget. I don't think we can get our minds around this epidemic unless people know what a calorie is and have a calorie budget. Generally, a person's calorie budget is 1,800 to 2,200 calories. You should know that a pound is 3,500 calories. So let's look at some broad strokes. If you cut 1,000 calories out of your diet each day, like if I saw somebody today, we estimated he's eating 3,500 calories, needed to be eating 2,200 or less. So he cuts 1,000 out because he knows he's eating a ton at night. That would be 2 pounds a week. Or, you know, 500 is 1 pound a week. So there are some broad strokes to dealing with this. But if you don't know how many calories you're eating or what your calorie budget should be, that's a big deal. It's hard to really wrap your mind around this. Exercise at a minimum, 150 minutes a week. So that could be 37.5 minutes for 4 days of the week. It could be 50 minutes for 3 days or 30 minutes for 5, but frequency is important and it should be moderate. And activity, yes, I'm active and I have my little watch and I know my steps, not the same as exercise. And this is the amount of time needed for just basic optimal health. There's a natural law called entropy. It's part of the law of thermodynamics. You know, there's like gravity is a law and these natural universal laws. Well, it's a law that says things go from a state of organization to ruin if just left to their own devices. It's like weeds overtake gardens, cars begin to rust. Same thing is with exercise in our bodies. We all know if we just sit around quietly for a while, you know, we'll start to lose muscle mass. We'll start to lose bone density. So we can't maintain or help reduce that without putting energy or work into the system, and then that's exercise. Keep that in mind. And I think the last thing I'll probably, so look at all these benefits of exercise. The last thing I'd like to tell you about is just a real quick thing on your medications. When you come in to see the doctor, try to bring all of your medications so there's no question about what you're taking, or at least keep a good list. One thing I will tell you is that sometimes, for whatever reason, you go to the pharmacy for a generic drug and they tell you it's going to be hundreds of dollars. and it makes no sense. And you knew the drug used to be maybe 10 about 2 years ago. I've had that experience. I've had patients have that experience. I can't tell you precisely what's going on, but you should know that if you go there and you get charged a lot, or they tell you it's a lot of money, ask them how much it's going to be if you just paid cash. It's counterintuitive. It's contrary to what you know and believe. You'd think it'd be less expensive with your insurance, but many times if you're getting charged a lot of money for a generic drug, paying cash or using something like GoodRx can help. I've had people come tell me their generic blood pressure medication is $160 a month. I'm like, are you kidding me? I'm sorry, what's going on? And we made a few calls, and she can get it for $20 a month. You know, I had somebody tell somebody in our family that their medication I knew was on a Walmart $10 list at one point. It was $330, they told me. And I said, well, how much is that going to be if we just pay cash? So, I mean, I know this sounds ridiculous. You know, there's a lot in our healthcare system that's really kind of crazy, isn't right. But there's a lot of good too. That's just something I want you to know, that I think anybody should know, that they should check around and talk about that. But I think I'm about all done with everything. There were some other things about saving your rotator cuff as you get older, doing exercises. Ask your doctor about that. Save your rotator cuff, save your joints. You know, just do the sensible right things and get information from the best sources. And I think that's all I have today. Thank you very much for your time.
Well, thank you very much, Dr. Crim. A few questions have come from the audience, but the first one out of the box is a compliment. And here's the compliment. Here's the question. Will the slides be emailed to us? Now, that's like going to a great restaurant and having somebody ask for seconds. So we do hope to post your presentation. It's being recorded, and we hope to post it on our website so people can relearn all the great things that you've said. We do have a few questions. I'd like to start with one. What are your 2 top healthy lifestyle habits that you would wish everyone would develop?
Okay, that's excellent. I'm going to add just a slight third, which is, I would just say quickly, I don't think there's anything that I could do or have a greater impact on someone is that if they're smoking, to get them to stop smoking. That is the single most important, greatest thing that we could do to enhance your quality and quantity of life. But aside from that, it's maintaining a normal weight and exercise.
That's great.
Yeah.
That is great. So here's another question. I've read that a person can be physically fit, look great, but still be unhealthy. How can that be?
Okay. Well, you know, it's just like, you know, sometimes a lot of things look nice. It's like, you know, maybe having a nice looking house and it's dirty or unkept on the inside. You know, sometimes people just have strokes of bad luck. It's like a person with type 1 diabetes. They might look well on the outside, but they actually, their sugars are kind of off the rails. So genetically, you know, people just, you know, genetically from a cholesterol standpoint, they've got high triglycerides, high cholesterol, they've got high blood pressure, their sugars are off. It just happens. And sometimes, you know, even if you're exercising and eating the right things, those things happen. And so that's why secondary prevention and seeing your doctor for wellness exams is important.
That's great advice. Here's another question. If our insurance pays for a single wellness visit per year, should we see our doctor more often if there are otherwise no problems or symptoms?
That's a good question. I think that's the answer to that is kind of a relative situation. If you're, you know, less than 50 and otherwise know your health to be, you feel like your health is in good hands, a good state, I think a once a year visit is very adequate if you don't have anything else on the radar. If you, I think there are a lot of people that have, you know, 2, 3, 5, even 7 medical problems. And I think those individuals at a minimum should have a wellness visit once a year and at least a semi-annual visit at 6 months and sometimes more often.
Okay, here's a question from the crowd. What is the least amount of exercise that I can do and still get benefit?
I think 10 minutes. I think they're showing that really, like, being sedentary and immobile is so bad for you that even if you can, you know, get 10, 15 minutes, ideally 20, but it has to do with the extent of the exercise as well. But really, any movement is, I don't think you're going to get great benefit if you're only doing 10, 15 minutes. But any movement is better than no movement. There's even some studies that actually show this. This should be eye-opening, that your risk of mortality is increased if you're unable to get up off the floor, without help or without, pushing off of something. So that kind of gets at your level of fitness. I think a lot of us have gotten to the point where we realize, like, wow, I really enjoy shoes that don't have laces, and that kind of tells you maybe I'm going the wrong way. I got to figure something out, do something differently.
That's good advice. It's going to be 5 degrees on Saturday. What suggestions do you have for exercise that someone can do inside?
Okay, great. Yeah, that's a great question. I think being outside is great, but I really am a big believer, especially now with COVID and gyms, and you worry about going to gyms. Personally, I think most of us don't have enough time in the day to spend 20 minutes going to the gym and 20 minutes getting back. That's 40 minutes that you've just kind of spent getting somewhere, getting back, and not even exercising. So I would really tell you, I think it's important to try to figure out how to get your exercise in and around your own home, so that you don't spend that time going and coming back from the gym, unless that's your hobby and avocation to do that. But inside, I think doing stuff like Tai Chi and Pilates and yoga and just core strengthening exercises, basic calisthenics, all of those things are things that, I'm trying to incorporate and learn more about. And there's a lot of great instructional things on YouTube and on the internet that can help you learn some of these things.
Great. Here's another question from the group, and I apologize for the little yellow box. It's a little gremlin. So in terms of exercise, how strenuous should the exercise be? For example, does walking benefit us? Does simple stretching each morning help? Or do I need to run a marathon? What is a good recommendation?
Right. Well, so I don't think you need to run a marathon by a long stretch. In fact, that can be pretty hard on your body to some degree, on your joints, but I'm not discounting that. I think those people are in very good condition. I think you need to strive for moderate activity. I think at a baseline, walking and basic stretching is very valuable. Don't underestimate the value of just doing that, especially if you're not. But if you can get to the point where you're doing some interval training, getting your heart rate up, doing some things, and you want to do that safely. If you've got risk factors for heart disease, you want to talk to your doctor about, advancing your exercise plan. Start low and go slow. But it should be something to hopefully get your heart rate up for a little bit and then come down, and get it up for a little bit and come down. So the more strenuous you can tolerate safely, the better. But even just walking and stretching will produce a tremendous benefit.
So I want to read a comment from the crowd, and I'm not going to identify the person that has written this, but I want to read it verbatim. The calcium heart scan saved my husband's life. $50 when we went to North Kansas City Hospital. His father died at age 60 of a heart attack. My husband was slim and exercised regularly. Heredity means everything. My husband had a triple bypass at age 67.
Okay. That's a great comment. I'm glad that was brought up. That's actually part of my presentation, but we were kind of going through it in kind of a whir. It's part of those testing things. If I can get back to it here real quick, give me just a quick moment to go back.
Okay, you look for it, and I'm going to tell my calcium story.
Okay.
So I was a surgeon in my earlier life, and at age 55, I did the $50 meal deal and got a cardiac scan, and I'm happy to report that it was fine. And I was telling one of my surgeon colleagues about this, and this gentleman was a triathlete, a runner, a swimmer, and he did the $50 cardiac scan, and his calcium score was 1,500. And it is it was a shocking revelation. And how many people How many people would be willing to spend $50 to find out a piece of information that could save their life? And I really do encourage all the listeners to consider that cardiac scan, that $50 cardiac scan, and consider bringing their loved ones and getting that done. The scan itself takes a minute or two. The results come out in short order, but it is truly, truly a lifesaver.
I couldn't agree more. I think it's a wonderful test. I think it's a wonderful benefit and service that a hospital provides to offer that CT of the heart for such a low cost. It's something that's not covered by insurance, but that's why it's such a low cost, being offered at such a low cost. You can look up here, that CardioScan calcium score has a 98% sensitivity at detecting significant disease in people that really have the disease. The downside to it, though, is you get a lot of false positives. See that 40% over there is specificity. So it's going to detect disease a lot, but whether it's significant or not, there's a chance that it's not. But what it does is it's a doorway or a gate that allows you to get in, because if you have a positive test, then we can go and we can order one of these more reliable tests to see if you've got significant disease. And that's what a lot of these people do and go on to do. I've had patients go on to do that. I recommend, anybody with risk factors, and that could even be just being, in your 50s or 60s, because this is meant to detect disease before you're symptomatic. That's the whole point. Is I had a patient who had this and ended up having a bypass 6 months later after he went through all the testing. But the whole point of testing and prevention is to get something done before something terrible happens. And as with that example from Dr. Reinches, you can be very healthy on the outside and genetically have some stuff going on. This person probably had significant lipid issues, and oftentimes bad cholesterol isn't lowered that much by exercise.
So here's a question on diabetes. Why are the two types of diabetes separated for the access tiers for the COVID-19 vaccine? Type 1 is an autoimmune disease and just as much a risk factor for COVID as type 2.
Okay.
You want to take that one, or do you want me to take that one?
Well, I'm going to take it and then kick it back, because one, I did not know they were being separated in terms of vaccine access. Number one, because I'm not sure why they would choose to do that. And I think so maybe Dr. Reinches knows. I'm going to just toss it back to you. I don't have an answer for that.
So in the state of Missouri, they have a phase system and a tier system. And phase 1A was vaccinations for healthcare workers. Phase 1B, tier 1, was for first responders, police, fire, and EMS. The state of Missouri has announced that they are in phase 1B, tier 2. Phase 1B, tier 2 includes all peoples in Missouri who either live or work in Missouri who are above the age of 65, the age criteria, or if they're between the ages of 18 and 64 that have a comorbidity. That comorbidity, or that risk factor, includes diabetes, and it does not distinguish, to my knowledge, between type 1 and type 2 diabetics. So we know that type 2 diabetics typically have obesity as a confounding risk factor. So at this juncture in the state of Missouri, all those who live or work in this great state are eligible for a vaccination if they're in phase 1B, tier 2. Now, I'm going to put a plug in for our coalition and our coalition partners. This week, we're standing up a vaccination center at Cerner World Headquarters in collaboration with Clay County Health, Liberty Hospital, and our cities in Clay County. And we are encouraging people to sign up and get vaccinated. I had a discussion just this day with the public health director of Platte County, and we are discussing opportunities for the good people of Platte County and their vaccinations. We are trying to deploy as many vaccines to the people in the Northland to protect them from the scourge of COVID-19.
I think that's wonderful. I recently became aware of that. So basically you're saying it doesn't sound like in Missouri there's really any distinction in terms of giving those vaccines for the type 1 versus type 2 at this point that you're aware of. Yeah.
That is correct. And I would encourage everyone to sign up the interest form. If you go to Clay County Health and go to their website and you go on and click on the COVID-19 questions, you can fill out a survey and sign up. And as soon as vaccines become available, we're going to deliver them. And it is our expectation that during the mass vaccination clinic this week on Thursday, Friday, and Saturday, 4,500 folks will be vaccinated. And we're going to deploy this as long as the pandemic is around.
Yeah, that's amazing. I would go on to say that I don't know that everyone is aware of this, but North Kansas City and some of the other hospitals, but not all, offer a monoclonal antibody infusion outpatient therapy to some groups of individuals with COVID, people 65 and older, and those younger that have vulnerable comorbidities. And so I think that's also a great service and opportunity for people who do get the disease early on within the first week, should contact their physician if they feel as though they're at higher risk. So that's another, I think, amazing thing that's being done here at North Kansas City and some other hospitals in the region.
Well, Dr. Crim, I just want to thank you for joining us. I wrote down a few notes to self on your presentation, and I hope to act on those. We really have gained a better understanding on how health and wellness go hand in hand, and a few actions to take. My last comment is that February is American Heart Month, and to celebrate, we're hosting 3 free Test Your Ticker health fairs. But before I announce the dates of the health fair, I want to talk one more time about cardiac, the calcium scoring, the cardiac scan. Anyone on the line can sign up at www.testyourticker.com and sign up for that cardiac scan. So let me talk a little bit about American Heart Month. On Thursday, February 11th, we're going to have a Test Your Ticker health fair at the Gladstone Community Center from 8 a.m. to 11 a.m. On Thursday, February 18th, the Grove at Zona Rosa is going to host a Test Your Ticker health fair from 8 a.m. till 11 a.m. On Wednesday, February 24th, the North Kansas City Hospital Wellness Corner at North Kansas City YMCA is going to be held from 8 a.m. to 11 p.m. Now, here's what's going to happen at the health fair. Each health fair will offer a full lipid profile and an A1C test, which is a test for diabetes. The health fair will check your height, your weight, your body mass index, your blood pressure, and your blood sugar levels. There will be healthcare professionals, maybe not Dr. Crim, but there will be healthcare professionals there to answer your questions. At North Kansas City Hospital, we're ready to care for you and have precautions in place to keep you safe. Again, I want to thank you for joining us. I want to thank Dr. Crim for his excellent presentation. We hope to see you at one of the health fairs. Please save the date for our next virtual Lunch and Learn on March 18th, when Dr. Kelsey Abel will present Irritable Bowel Syndrome. What can I eat? Have a good afternoon, and thank you for joining us.